If you can't make it to the AUA, I'm going to try to bring the AUA to you. And this is Saum with a line of innovative products, not just for sexual function, but also for pelvic floor disease. And I would like him to kind of talk about this particular thing, and then we'll move on to other devices which may be helpful to your patients. Go ahead, Saum.
So I'll start with Tenuto 2, which is one of our very early devices. It's been around for almost 10 years, has over 100,000 patients in the US.
Nice.
So the focus is on vibration therapy. So all our devices use 100 Hertz frequency vibration.
This is for the penis.
This is for the penis, for erectile dysfunction. It stimulates the glans with 360 vibration, also the perineum at the same time. So this dual stimulation.
This goes to the perineum. Got it.
Yep. And the scrotum is here, and the gap is for ejaculation. So make it really comfortable and very adaptable. So it uses a very special material which can flex and adapt to up to 95% penis girths, and then constrict and never lose that rigidity.
Nice.
So it vibrates all around. It's very quiet, but a very precise vibration, which has over 30 years of research.
So what kind of, a lot of research behind it, what kind of patients would benefit from this?
So various ED. So we have papers on neurogenic ED, post-spinal injury, psychogenic ED, ED after radical prostatectomy, ED after radio chemotherapy. So all of the types of EDs.
Seems like a broad range, including very psychogenic. And what is interesting is that it not only, I'm feeling the vibration now, not only does it stimulate the penis, it also stimulates the perineum.
Correct, exactly. And what we find is this dual stimulation is extra helpful for extreme ED, the severe ED, like after prostate surgery. So the core physiology is the blood flow. Having this much stimulation pushes the blood through the penis, and then the constriction holds it.
Natural blood flow,
with the gap for the
very nice. What other device do you have? I know you have a whole line of them.
So then this is a very similar device. It's a small version of Tenuto 2, which is the Mini, and it's simply for people who would want a more compact, discrete device. So it's very similar.
So it goes on the base of the penis.
Correct. It doesn't have the perineum stimulation, so it's less powerful, but also less bulky.
Less bulky, yeah.
And this one is a very useful device for prostate health. So it is very useful for prostatitis. So we have a paper on that. It's very useful for ejaculation. So anejaculation, delayed ejaculation, especially after diabetes. So we have a paper on that. It's very useful for erection as well through prostate stimulation. So it is simply a mimic of the index finger, just like a clinician would insert a finger to press the prostate for pain relief. The patient themselves or the clinician can insert it, reach the prostate, vibrate the prostate, and relieve the pain. Okay,
so either the patient can use it or the clinician can use it.
Okay. So the main use case of this is often when men have their prostate exam. The clinicians we work with, they would give the device at the time. They'll show them how to use it, and then they'll use it regularly, because they'll probably see them in a year's time, and then by using it regularly, they'll have a much better prostate health.
So basically, you can also dispense it in the office to the patient.
Exactly. So that's how most of our patients get it. They get, like with pelvic floor therapy, like with prostate pain, they get the first session, they get trained, then they use it at home.
Very good. And now you guys sell through a distributor.
Yes. And just a quick one on the female sexual health.
Yeah.
So this one mimics 2 fingers, very much similar to the prostate device, but much longer to be able to reach all the much deeper to reach all of the pain points for hypertonic or for general postnatal pain, and be able to again vibrate those pain points and have relief.
So possibly a diagnostic purpose.
Yes, it's used very commonly. That's our oldest device. That's been around for 11 years. It also has over 100,000 patients, and that one has the most publications.
Sounds like there's a lot of clinical data behind a lot of products that you sell. How would practices get these devices and also get them to the patients?
In US, we work with Medline as our distributor. Also, we are listed in the US Veterans Affairs. So
VA,
VA gets all the veterans can get our devices completely for free, which was a big piece for us, is making them accessible, because erectile dysfunction is one of the biggest issues for active servicemen and for veterans.
Definitely.
And pelvic pain is one of the biggest issues for female soldiers. So all of our devices are covered in VA. For general public, they're covered by FSA HSA. Yeah.
Very good. All right, I appreciate it. Thank you so much, and I will leave the link to MP Health in the video description. Thanks for watching.
Thank you.